First the grief, now the fury. This was the alarming scene outside a Delhi hospital as the family of a 62-year-old woman vented their anger at medical staff for not admitting her. She died because the health system has collapsed into chaos. Footage filmed for us inside one hospital by a doctor shows how desperate the situation has become. The gasps and groans of seriously ill COVID patients waiting in the corridor. Here at least they are getting oxygen. Many more outside are dying without any.
We are weeping, we are crying, we are helpless sometimes when we are not getting resources. It is not the problem of doctors. Doctors are doing their duty 24/7. If oxygen is not being supplied in the hospital, is it the fault of doctor? It is not the fault of doctor.
There is precious little time for the rituals of death and mourning at the crematorium. The bodies are arriving every minute of every hour. Many think the toll is far greater than the more than 3,000 per day officially acknowledged. Those who have the grim task of transporting the dead or dying are themselves taking huge risks. Nitish Kumar earns a meagre wage from families who pay him to try and find a hospital bed or crematorium, and he's reached breaking point.
बहुत डर लगता है, मानते हैं कि अपना भी परिवार है ना, जब गाड़ी में देखते हैं पेशेंट का जब डेथ हो जाता है तो रोते भी लगते हुए आता है घाट पर सब, तो देख को बहुत खराब लगता है हमको, इसीलिए ये गाड़ी नहीं चलाना है हमको.
So great is the burden that flower beds are being turned into funeral pyres in the parks as India struggles to cope with this great wave of loss. Cremations here are up tenfold since the beginning of the month, are even beginning to run out of wood. These searing images should act as a warning to us all that COVID-19 can return with vicious rapidity to turn a crisis into a nightmare. Dan Rivers, News at 10.